Hey viewers, welcome to Earth and Life 101. For this video, we will be discussing hyperthyroidism, a disease that affects millions worldwide. You may be wondering, what is hyperthyroidism? Check this out!
Hyperthyroidism is a condition where the thyroid gland produces excessive thyroid hormones. Your thyroid is a small, butterfly-shaped gland located at the front of your neck under your skin. It's a part of your endocrine system and controls many of your body's important functions by producing and releasing or secreting certain hormones.
Your thyroid's main job is to control the speed of your metabolism, which is the process of how your body transforms food you consume into energy.
What organ system is affected by hyperthyroidism? The organ system that is mainly affected by the said condition is the endocrine system. The endocrine system is a network of several glands that create and secrete hormones. Hyperthyroidism significantly disrupts the normal function of the endocrine system by causing an overproduction of thyroid hormones, or T3 and T4, from the thyroid gland. Normally, TSH regulates thyroid hormone levels, but in hyperthyroidism, high levels of T3 and T4 inhibit TSH release, leading to further hormone imbalances. Causes of hyperthyroidism. In more than 70% of cases, hyperthyroidism is caused by Graves' disease. Normally, the immune system helps protect your body against viruses, bacteria, and other substances. An autoimmune disease causes it to attack the body's tissues and/or organs. With Graves' disease, the immune system stimulates your thyroid, making it produce too much hormone. Doctors think Graves' disease may run in families. It is most common among young women. Thyroid nodules can cause hyperthyroidism when they become toxic or overactive, producing excess thyroid hormones T3 and T4 independently of the body's regulatory control. These nodules, known as toxic adenomas or toxic multinodular goiters, release thyroid hormones without responding to the usual feedback signals from the pituitary gland, leading to elevated hormone levels and hyperthyroid symptoms such as weight loss, increased heart rate, and heat intolerance. Thyroiditis can cause hyperthyroidism through inflammation of the thyroid gland, which leads to the release of stored thyroid hormones into the bloodstream. In conditions like subacute thyroiditis or autoimmune thyroiditis, such as Hashimoto's thyroiditis, the thyroid tissue becomes damaged or inflamed. As a result, preformed thyroid hormones are released, causing temporary hyperthyroidism. This phase may be followed by a period of hypothyroidism as the thyroid gland's function declines due to the ongoing inflammation or damage. Also, excessive iodine intake can cause hyperthyroidism by supplying the thyroid gland with more iodine than it needs, leading to overproduction of thyroid hormones T3 and T4. This condition, known as iodine-induced hyperthyroidism, often affects individuals with pre-existing thyroid conditions or nodular goiter and can result from consuming iodine-rich foods, supplements, or certain medications.
How can you identify if you might have hyperthyroidism? There are common symptoms of hyperthyroidism. These are rapid heartbeat, unexplained weight loss, increased appetite, nervousness and anxiety, sweating and intolerance to heat, fatigue and muscle weakness, and lastly, changes in menstrual patterns. If you are experiencing any of these symptoms, then it is highly advisable to go to a doctor because fortunately, there are existing treatments of hyperthyroidism.
Treatment depends on the cause and severity of symptoms. Hyperthyroidism is usually treated with one or more of the following: anti-thyroid medicines, propylthiouracil or methimazole, which reduce or block the effects of extra thyroid hormone, radioactive iodine to destroy the thyroid gland and stop the excess production of hormones, surgery to remove the thyroid gland, If your thyroid is removed with surgery or destroyed with radioactive iodine, you must take thyroid hormone replacement pills for the rest of your life. Unfortunately, you cannot prevent hyperthyroidism because it's often caused by genetics or autoimmune conditions. However, there are some things you can do to reduce your risk and manage hyperthyroidism. That's right. To reduce your risk, you may eat less processed food and sugar, eat less soy, consider selenium supplements, get regular checkups, following your treatment, talking to your doctor, and quit smoking since smoking can increase your risk of developing Graves' disease. If you suspect you have hyperthyroidism, it's crucial to consult a doctor for diagnosis and treatment options, which may include anti-thyroid medications, radioactive iodine therapy, or surgery. While prevention is difficult, you can manage your risk through lifestyle changes such as reducing processed foods, avoiding excess sugar and soy, considering selenium supplements, and quitting smoking.
To wrap up, hyperthyroidism is a condition characterized by the overproduction of thyroid hormone, primarily affecting endocrine system. The most common cause is Graves' disease, but other factors like thyroid nodules, thyroiditis, and excessive iodine intake can also contribute. Thank you for joining us on this episode of Earth and Life 101. Remember to stay informed about your health, and we'll see you next time.